looking at life and work from the viewpoint of the team members, clearly generations under your leadership, you're positioned for the quadruple aim, which is to deliver individual great care, improve patient level, population level outcomes, reduce the total cost of care while taking care of the care providing team. And that fourth component is vital as we know it, because the pandemic clearly has strained the healthcare teams beyond limit in many cases. So thank you for sharing that. Out of all these major initiatives and success throughout the last couple of years now, what's the one major success story that stands out?
I'm very pleased that you think that all this success is attributed to me. I have to tell you that it should not be, because it's really the team's success. And so the team, I think, is the most important lesson that we've learned. You need to have a good team. You need to have good communication within that team. You need to be supporting your team. You need to be understanding clearly what is in front of them, and you need to trust your team so that the right work happens at the right level at the right time.
What's the one biggest lesson learned, or something that you wish you had known or done differently?
The things that I would have done differently is I would have made sure that there was 90-day supply of PPE. Okay. However, I don't think that was really singularly the only thing that we needed. There were many innovations that we did. We improved our communication. We improved our communication by using web-based tools. So if you look at our website, we always provide accurate, up-to-date information, which anybody could use to navigate the system. It'll tell you where testing is going to be, not just within our four walls, but in the broader community as a whole. The one thing that I will say that is really defining for us, not just as a community, I think as a nation, is the need for integrated behavioral health services. It has really defined our ability to leverage the resources against the COVID pandemic. And these kinds of shortages, the lack of psychiatry, the lack of support for these programs, has really been a defining element in limiting our ability to leverage ourselves on this. But be that as that may, telehealth has opened so much for our patients.
Absolutely.
The ability of having your provider on the phone speaking to you about your health care, I think is absolutely exciting. And I'm thrilled with that ability, because I think that's a new thing that we have, and I think that really bends the equity curve for patients.
And it's here to stay, even post-pandemic.
I know you're using those words cautiously, because things are our payment mechanisms are defined by the insurance companies, and when you say they're here to stay, I would hope that it makes economic sense, because it just makes sense for first to be doing early treatment, and then later on following up with the complex care and the complex plans that are required to support these patients as they transit through difficulties.
Makes sense. Can you share with us your own personal journey? How did you come to lead generations? And then perhaps you could share with us some of the impact that you have noticed on the organization through COVID.
I came to this country and I studied not-for-profit management, and I found myself working in a for-profit world. And my employers were very happy with me because I was very successful for them. However, I couldn't apply my not-for-profit management. And so at the age of 30, I applied for a little teeny tiny job, and I was in Bridgeport. There was a small little health center, and they hired me And within a month, I was their finance director. And within 6 months, I was the chief financial officer. Then I was the chief operating officer. And then I worked there for 13 years. And then I had an opportunity to come here. I've always been interested in technology, always been interested in workforce, always been interested in changing the lives of patients. So my motivation is, are you feeling better today? How's your appointment? Making sure that the needs of patients are being addressed, and the organization has that same goal. And so, this is alignment. We managed to collect, 235 people over here in our organization that are all focused on the same thing.
One goal.
And knowing that there's no wrong door for the patient, and making good choices for patients, and helping them navigate and transit through a difficult system.
Great. How has COVID impacted the organization?
Operationally, because of the nature of the pandemic, we had to restrict our face-to-face visits. So the organization had to very quickly purchase all kinds of laptops to take home. Develop different kinds of video conferencing. So I think we've got 3 or 4, maybe 5 different video conferencing platforms that we use for different things. We had to boost our bandwidth, because now all of a sudden we've got 4 locations that are transmitting data back and forth. The investment in technology was very significant for us. It allowed us to meet our patients where they were at home, provide them with good services, and make sure that while they were in lockdown, that their anxieties, their issues, we helped them. We called patients sometimes every day. The development of quality in systems like that is very difficult, because bureaucracy that follows healthcare, you can't measure HEDIS scores just like that. You have to make sure that they're inherent in the medical system. They can't be anecdotal. You can't be entering it like this or that. And so it's really, this investment has really helped us. It's really been good to see our quality maintain its high level, especially when it comes to, the management of hypertension, hemoglobin A1Cs, things like that are really critical for patients. And, ultimately, we've got to realize that, this pandemic is going to come and go, but the care for these patients is going to be continuous.
Great. So as you said, the pandemics will come and hopefully they'll go soon, but the work continues. How do you see generations changing, evolving in the next 5-10 years? Where do you see the future?
There's more and more things that can be done to make sure that population health standards are being maintained. In the rural part of the state, I will predict that we will continue to see a consolidation in the hospitals and more issues of access to patients. And this is where I think technology can really help us. By using telehealth and by using algorithms, we can anticipate and we can predict with great accuracy what our patients are going to need. In the rural part of the state, the acuity of our patients is about 2.5 times more than it is in just the natural risk in the community. And so it's in the management of that risk that we have got to really make sure that we're reducing the cost for care, because that's the 4th value that you were talking about in the quadruple aim. Healthcare should not cost so much. There's absolutely no reason why it should cost so much. I would like to see patients have much more choice.
Absolutely.
Because I think ultimately, to get me to prevail upon my own determinants of healthcare, I have to take charge of my healthcare. I have to say that, okay, this belongs to me, and this is my equipment, and I'm going to look after it like this and that. And I think that's why we've got to have more tools in the hands of our patients as bigger partners with us and not just participants. They need to have that ownership and that sense of connectedness with the healthcare system that they're engaging in. And so I would like my healthcare to look a lot more like me, okay? If you know what I'm talking about, you know,
yes.
There's nothing like being spoken to you in your own language, and people knowing where you live, and knowing where you pray, and knowing, you know, how you want to be treated. And, you know, I think it's as simple as that, you know, but in saying that it's as simple as that, it's very complicated, because as you know, we all come from different parts of the globe, and we all have different ways of being able to look at things. And it's our ability to look at things through each other's eyes that really make us compassionate.
You mentioned the value of having a care team that looks like us, that talks like us. And I'm sure diversity, inclusion, and equity is at the heart of the mission of organizations such as Generations. And as you mentioned, the social determinants of health, if they are one of the key prime drivers of outcomes, some say even as much as 80% of health outcomes are due to non-medical social determinants. How does an organization such as Generation envision its role in assisting members that they serve for those unmet social needs? Is it more of a facilitator, or do you even envision entering into some real estate investment that can serve as a medical intervention?
My gut tells me that you need to do it one patient at a time. And if you get the small things correct, the rest of the big stuff hangs together. That works for the first part of it in the hierarchy, you know, which is the access part of it. But when you go up into the other areas, into the quality now, into the population health aspect of it, into are you bending the cost curve? Okay, those require much more longer thought sequences and longer data points to look at those things. When we look at our healthcare, we see that the costs keep on accelerating, and they accelerate at a very fast pace. So I feel that to really contain these things, you need to have your healthcare systems homegrown. They need to be community-based. Institutions will serve institutions, but the community will serve the community. And that's why I think, you know, I would love to see, you know, academics be involved in this kind of environment. Because, you know, we're not the only intellectuals over here. Okay? I think our patients are the intellectuals too. They have that ability. They have this God-given ability to assimilate the information that they have. They have direct data which they can use to inform themselves. So I think it's by having these systems and having them inherent and having them homegrown, that's where we're going to get to a point where we will really be able to go and look around that corner and anticipate what you're saying. Please accept my thanks, and on behalf of our patients, thank you.
Thank you very much. We would love to have you and, you know, some of your team members come visit us at the tribe. You know,
we would love to come and see you.
We are fully vaccinated. We are still masking.
I'm on the board of the Community Health Foundation, Community Health Network Foundation. We have a program, it's called CARE. And CARE is, we take children, 13, 14, 15-year-old, inner city, high-risk youth. and we get them manicures, pedicures, hairstyling, facials, speech presentations, getting resumes together, internships, things like that. And we have made such a dent in that kind of equity. And it's wonderful. I tell you, it's so inspiring to go to one of those graduation ceremonies. And so they raise money for that.
Absolutely wonderful.
Yes.
And certainly it helps those children in need, but it's amazing how just the act of serving helps us as well in terms of growing and learning.
Otherwise we'd have no definition,
finding a meaning and a purpose.
Absolutely. And that's the whole nature of intention. Okay? If you don't intentionally do things, then it becomes just a random act. And I think you can't have predictability with random acts. You need to have that intentionality to put into your thought, so that when your thought comes out, there's an action plan with it, and you know what the trajectory is. Because if you've been studied and if you've understood what the physics and the chemistry and the biology is, you will know that it will have a certain path, it'll have a certain decay, and then it'll go.